The first symptoms I had was a bad back, and I had a really bad cold as well. So it didn't really matter what position I lay in or sat in, the pain just didn't go away. Initially, I did go and see a doctor relatively soon after I felt the first symptoms.
I was really fit, and in my mind, as long as I kept myself fit, then I would be fine. And I'd been training a lot at this stage for the Caledonian Challenge. So when my ankles and my legs started to swelling up, the kids forced me into going to see the doctor. So I had my test and then I stood up ready to go. And they said, "Oh, no, the consultant wants to talk to you." So I thought, okay, fair enough. Thinking, hope I'm going to be in time to pick the kids up from school. And he explained I'd need chemotherapy. And as soon as I heard chemotherapy, I kind of burst into tears. But yes, it's all those little things that gradually built up. And I suddenly had a diagnosis, which I wasn't expecting.
So I was diagnosed with myeloma in July 2020. And the only sort of symptom I had was that I'd had pain in my sort of lower back, around my right leg, and my movement was different from how it normally is. And then one morning I'd come down, went to feed the cats, and something just kind of snapped in my back and I couldn't move. So I kind of crawled to the living room, shouted, eventually somebody heard me and I was taken away in an ambulance to the hospital. I
think looking back, I really knew that there was something deep down that was wrong. But actually, once I got into the healthcare system and realised that there are some brilliant doctors and medical teams dealing with this, I was actually very confident about both the treatment and also my longer term outcomes. So actually being diagnosed early has meant that I can have 2 stem cell transplants and be in complete remission as I currently am.
It's a partnership you have with the health system. You're presenting them with something that, there's these kind of things I can't sort out myself. They've been bothering me for a while, and it's easier for them to say, oh right, I have a suite of things that can help you at this stage. You're not doing anybody any favours, particularly not yourself, by ignoring them. Because I did think, swollen legs, I'm just being vain. Why would I go and irritate my doctor? He's got lots of other things to do which are much more important. Even though 25 other people might have swollen ankles, go and see the doctor. It's only 5 minutes, isn't it? It doesn't really take a long time.
As a yoga teacher, it's one of the things that you sort of learn to listen to your body, and if you know that something's not right, you do need to go and voice that. You're the person that knows yourself best.
My advice to anyone that's got something wrong with them, that they're just not 100% sure what it is, and it's out of the ordinary, is without doubt to speak to a GP and make sure that you continue to do so, particularly at the moment and during COVID lockdowns, and perhaps it's slightly more difficult at the moment to actually see or speak to a GP. I would not allow that to be a barrier, because early diagnosis is fundamental, particularly with myeloma, to good outcomes.